Hello. I want to introduce you to Mila. Mila is just such a great transformation. She started out with an underbite class 3, which inhibited the eruption of the incisors, and in just 14 short months, we were able to truly transform this young lady. So hopefully you enjoy. Thanks a lot. Mila came in, she was 16, and she just had concerns that you can't see my teeth when I smile. Plus, she did have an issue with her bite. It was shifting and it was all over the place. Again, just a wonderful case that shows the power of the system and an accurate diagnosis. So we're going to start out with case planning. Again, let's look at how we set this case up. If we look at the comprehensive aesthetic diagnosis first, and then go into variable torque selection and ultimate bracket positioning, we'll get a good idea of how we set this case up for success. Now you can see that she has some arch constriction in the upper, and it's a little bit asymmetrical. She has a reverse smile arc. She's got an anterior and a posterior crossbite, along with an anterior and posterior functional shift. So by no means is this case, a slam dunk. On top of that, she's got that lower left molar that's kind of kicking outside, so that's not helping matters. But this is something that, knowing the technology, knowing that we have a dedicated patient, as long as she helps us, we're going to end up getting to the finish line. If we look at the x-ray, again, nothing that's too out of the ordinary, except for the fact that eventually we're going to have these wisdom teeth removed. And really, when you look at her cephalometrics, we've got a really good class 3. Now, her functional shifts make this a little bit more pseudo, but even when I tried to position her, she only went back about 1 millimeter, and laterally, once you centered the midline, the class 3 kind of, reverted back to a couple millimeters. So, we've got this class 3 anterior crossbite, posterior crossbite, an anterior and a shift. Really, this is, kind of an issue that we want to make sure that we open up the bite, we allow the mandible to come back, we treat the transverse, and then from there, dial in the mini and the microaesthetics. So when we look at torque selection, a lot of times we will show that we use retro on the uppers for class 3s and we use pro on the lowers. But let me explain this case because somebody was quite confused when I showed this at a meeting. The reason that I'm choosing procline in the upper 3s is because they're lingually tipped. And the reason I'm choosing retro on the upper 2 to 2 is because I know I'm going to use a lot of class 3 elastics, which is going to want to procline the upper anterior teeth. Now, in the lower 3s are lingually inclined slightly, so I'm going to use the pro on those. But the reason I chose retro on the lower 2 to 2 was because that lower left molar was so kicked out that I felt that after we brought that lower molar in and we constricted slightly the arch form, that I was going to end up with procline teeth. So that was the choice. And honestly, if I would have used procline, it would have worked out great because at the end, I think I was a little upright. Now, where do we place these? Again, class 3s are the only time that I move the bracket slightly more gingival. So we put them at 6 millimeters from the incisal ledge on the upper ones, 5.5 on the laterals, 5.5 on the canines, and on the lowers, 5 and 5.5. Again, I want to achieve about 1 millimeter extra overbite in these cases. So you can see here, nothing too crazy. The bracket positioning in the anterior is slightly more gingival by 1 millimeter total, and the posterior is exactly where we place these all the time because that's where the function is. So you can see that from beginning to end, we were able to dial her in. Again, I made reference that the lower incisors were a little bit upright. I think if I had used procline, I would have avoided that. But again, it's easier to look at these cases in hindsight, but definitely kind of want to show you what happened. So let's go ahead and break this down in a little bit of a rapid summary. We started with 0-4s upper lower, switched to 0-8s. The reason that I switched the upper to 140275 at month 3.5 and I stayed in the 0-8 is because that lower left molar wasn't in the right spot. If I would have advanced to a thicker wire, there was a chance that I would have bound the wire, created some shifting and some friction, and caused the lower left 7 to pop out. So I just let the crossbite elastics that she was wearing work and roll that lower molar in. She came back at 5 months, was able to advance to the next wire, and at 7 months we took the wires out. So here's where she was able to go at the end of phase 1. Now, I love this because I pretty much solved most of her problems. Her upper arches developed nicely. Her lower arches developed nicely. We corrected that lower left 6. The lower incisors are in a nice position. But now I have space in the lower. My midline's off to the left, but I also know that I can close the space on the lower right. So for me, I know what's going to happen here. This case is going to close up. I'm going to retract the lower incisors, and we're going to end up able to get a nice overbite because then the smile arc will let it go. You can see in this case that the wire still has activity in the upper plane. The reason that it still has activity is that it can't erupt the upper incisors until I have a positive overjet, which is going to happen here. So let's look and see what happens at the end of phase 2. So at the end of phase 2, we put our 180275 NiTi in, upper and lower. We continued our class 3s. I did begin to close space on the NiTi because, again, I want to get rid of that functional crossbite, and this is where we ended up. So just 3 months later, you can see that we're able to close up the spaces. The right side's class 1, the left side's class 1. The midline's still a little off. We've got a little work to do on some AP, but right now, we're looking really, really good. Phase 3, basically, we took out our 180275 NiTis, and we went ahead and put in 20.0275 niti in the upper because I wanted to upright those upper incisors a little bit more. I do think I probably should have left the 18.0275 niti in the lower because I think that would have given an expression of, at least where we needed to be. Or what I should have actually done is probably at the repo appointment, switch the lower ones at least to Procline to get those in the right spot. But nonetheless, I was just excited she was moving along so quickly. Here's where she has a week 4 debond. I got that left side settled just from time. That wire kind of expresses. You don't see any sort of deviation in the occlusal plane, which means we were fully expressing the smile arc on those uppers. It doesn't require gingival bonding to do that. Her occlusal plane is what's going to take care of that. So you can see in just 14 months, 9 appointments, this case treated out beautifully. Her smile is remarkable. Again, my only criticism in this case probably is my lower ones. I wish I would have had a Procline bracket on those and probably would have had maybe about 4 to 5 degrees more labial inclination. When we look at the pan, everything looks great. And again, when we look at the Ceph, we're really, really in a dialed in position. So again, the numbers show that we're doing really, really, really great work. So, for me to look visually and see the lower incisors are a little bit upright, but then if I trace the Ceph, they're pretty much right on as far as where we want them. Okay, and we can go ahead. Again, coming out of phase 1, that upper is really looking nice. Phase 2 is where that arch development really sat in. We held it there. Okay, now everything's looking really great, and we can finish that case. Now, this is really what's nice. When you look at smile arc, you can't achieve an ideal smile arc until you get positive overjet. You can see that happen at the end of phase 2, into phase 3, and into final. Same wires. I didn't have to bend anything. I didn't have to reposition the bracket more gingivally. It just let that wire work once we got positive overjet. So in 14 months, we're able to really dial this young lady in. And again, the microaesthetics just pretty much spot on. No bends in the wires. So when we look at the treatment statistics, we could see that she was 14 months, 9 visits, 0 bends. She was a model patient throughout the entire treatment, and we're so proud of her. Able to check all these boxes off and really do a great job. So hopefully you enjoyed that case. Again, if you did, check us out. Follow us on our socials. We have a lot of cases that are going to be dropping in the next 6 months. So hopefully you enjoyed, and take care. Good luck. Bye-bye.